Your dad had a heart attack. What does that mean for you? Hi, I'm a Dr. Ben Carter, and I get this question a lot. My dad had a heart attack. Does that mean I'm going to have one too? It's an honest question, and if someone in your family has had a heart problem, it's normal to feel nervous about your own risk. I've had patients come in after their father, mother, or even a sibling had a heart attack. They start noticing every little chest pain or flutter. Some feel like it's just a matter of time before it happens to them. So let me explain the truth, simply and clearly. Yes, having a close family member who had a heart attack, especially before age 55 for men or 65 for women, does increase your risk. That's what we call family history, and it's a real medical risk factor. But here's the part many people don't realize. Genetics are just one piece of the puzzle. They don't guarantee anything. And in many cases, your lifestyle plays a much bigger role. That means you're not powerless. In this video, I'll break it all down. How much of heart disease is inherited, what you can do to protect yourself, and how to take control of your future, starting today. Let's start by looking at what runs in the family and what doesn't. Yes, heart disease can run in families, but it's not that simple. Let's talk about what it really means when we say that heart disease runs in families. If your dad had a heart attack, especially at a younger age, like in his 40s or 50s, that raises a red flag. Doctors call this a positive family history. It means you're more likely to have some of the same risk factors. That might sound scary, but let me explain what's really happening. You may have inherited certain traits from your dad. You might have naturally higher LDL cholesterol. That's the bad cholesterol that can build up in arteries. Or your body may not handle blood sugar well, which can raise your risk of diabetes, another factor that affects your heart. Some people inherit high blood pressure, even when they're young and otherwise healthy. But here's what's important. Having these traits doesn't mean you'll have a heart attack. It just means your risk is higher than average. Think of it like this. Your genes might give you a head start toward risk, but they don't control the finish line. And in most cases, lifestyle has a bigger impact than genetics, especially when you start making changes early. So let's look at what actually gets passed down and what doesn't. What you inherit and what you learn. When people think about family history, they usually think about genes, and that's part of it. But just as important is something we don't always think about: habits. You might inherit high cholesterol from your dad, but you also might have learned to eat the same kind of food he did. Maybe your family didn't exercise much. Maybe meals were heavy in fried foods, red meat, processed snacks. Maybe no one talked about stress or how to manage it in a healthy way. That's not genetics, that's environment. And here's the good news. Habits can be changed. Genes can't. Let me give you an example. I've had two patients, both with strong family histories. One ignored it, smoked, ate poorly, sat most of the day. The other took it seriously, ate better, walked daily, got checkups. Guess who had the heart attack? Not the one you'd expect. That's why family history is not a life sentence. It's a warning sign, a reason to pay attention. But most of the time, it's your daily choices, not your DNA, that decide your outcome. Next, let's talk about how doctors check your risk and what numbers you need to know. What increases your risk and how to check it. Now let's get specific. You might have a family history, but how do you actually know your risk? Here's what I look at as a doctor. These are the big risk factors for heart disease. High LDL cholesterol, that's the bad cholesterol that clogs arteries. High blood pressure, which puts extra strain on your heart and blood vessels. High blood sugar, or diabetes, which damages arteries over time. Smoking. Obesity, especially belly fat. Lack of physical activity. And yes, family history of early heart disease. The more you have, the higher your risk. If your dad had a heart attack, it's a good idea to get screened early, even in your 30s or 40s. Your doctor may run a cholesterol panel,
a blood pressure check, a fasting blood sugar or A1C test for diabetes. In some cases, a calcium score, that's a CT scan that looks for plaque in your arteries. These tests help us see what's happening inside your body before symptoms appear. Because here's the thing, most heart attacks don't come with a warning. You feel fine until you don't. So knowing your numbers now can help prevent a crisis later. Next, I'll walk you through what you can do starting today to lower your risk.
What you can do right now to lower your risk. Now let's talk about what you can actually do, starting today, to protect your heart. Here's the bottom line. You can't change your genes, but you can change almost everything else. And those changes matter a lot. Let's start with food. The best thing you can do is eat more whole foods, vegetables, fruits, whole grains, nuts and beans. And cut back on processed foods, red meats, added sugars, fried or salty snacks. This isn't about dieting. It's about giving your heart what it needs and avoiding what clogs it up. Next, move your body. You don't need a gym, just walk. Aim for at least 30 minutes a day, most days of the week. Then there's sleep. Poor sleep raises your blood pressure, blood sugar, and inflammation. Shoot for 7 to 8 hours a night and try to keep it consistent. Don't smoke. If you do, quitting is the single most powerful change you can make. And yes, stress matters too. Chronic stress increases heart risk, especially when it's paired with anger, anxiety, or poor coping habits. Finally, medication. If your numbers are high, cholesterol, blood pressure, blood sugar, your doctor might suggest meds like statins or blood pressure pills. That's not failure. That's smart prevention. Because heart disease often builds silently, we need to act before symptoms show up. In the next part, I'll explain how lifestyle can actually overpower your genetic risk if you stay consistent. You can't change your genes, but you can outsmart them. Here's something I tell my patients all the time. Genes load the gun, but lifestyle pulls the trigger. You might have a family history of heart attacks. That means you're starting with a higher risk, but it doesn't mean you're destined for the same outcome. In fact, studies show that even people with high genetic risk can avoid heart disease entirely if they follow a healthy lifestyle. What does that mean? Eating real, unprocessed food, moving regularly, not smoking, sleeping well, managing stress, getting regular checkups. These changes may sound simple, but they work. Your body responds to the choices you make every day. Even small improvements like walking 20 minutes or switching from soda to water make a difference over time. You can think of it like this. Genetics is your starting point, not your destiny. And every good habit you build is like adding a layer of protection around your heart. So don't let family history scare you into feeling helpless. Let it motivate you to take action early and consistently. In the final part, I'll give you a quick summary and the one mindset shift that changes everything. Final message. You are not your genes. Yes, your dad had a heart attack. That means you should pay attention. You should know your numbers. You should take your risks seriously. But it does not mean you're doomed to repeat the same story. In fact, the fact that you're asking questions, that you're learning, watching, listening, that already puts you ahead. You can be the one who breaks the cycle in your family. You can be the reason your kids grow up seeing what prevention looks like, not just hearing about a hospital visit. Talk to your doctor. Get your labs checked. Start small. Walk a little more. Eat a little better. Sleep a little longer. You don't have to be perfect. You just have to be aware and consistent. Because when it comes to heart disease, knowledge is power. But action, that's what changes your life. Thanks for listening.
Final message. You're not doomed by your genes. If there's one thing I want you to take away from this, it's this. You are not your genes. Yes, your dad had a heart attack. That means you should pay attention. You should know your numbers. You should take your risks seriously. But it does not mean you're doomed to repeat the same story. In fact, the fact that you're asking questions, that you're learning, watching, listening, that already puts you ahead. You can be the one who breaks the cycle in your family. You can be the reason your kids grow up seeing what prevention looks like, not just hearing about a hospital visit. Talk to your doctor. Get your labs checked. Start small. Walk a little more. Eat a little better. Sleep a little longer. You don't have to be perfect. You just have to be aware and consistent. Because when it comes to heart disease, knowledge is power. But action? That's what changes your life.
If you care about prevention and your health, subscribe to the channel. Here, we talk in simple language about how to understand your body and keep your heart healthy.
Has anyone in your family ever had a heart attack? Did it change how you think about your own health? Share your story in the comments. I read every one.